Hi, everybody. Welcome to an emergency session of This Week in Medicine. We thought we'd take 5 or 10 minutes this evening to discuss and explore the panic news media inbox that we received today at the office. Hot off the press, we had a report from CNN that you should stop taking your aspirin if you're over 60 years old. Decrease your use because it could be dangerous to you and cause problems with not preventing heart attack and stroke. We had the Washington Post saying limit your use or curtail it, according to the New York Times. So we got a flood of emails into our inbox, phone calls. CNN, Washington Post says the United States Preventive Services Task Force says it's time to stop taking my baby aspirin if I'm over 60. This is the same organization that at one time told us we shouldn't be doing prostate cancer screening with the PSA. And since then, they've changed their tune based on a reanalysis of old data. So this evening, I've invited Dr. Yamamoto, our cardiologist guest speaker this evening, to explore with us these panicked media press releases that we saw today that prompted many of you to ask, should I even be taking baby aspirin? The answer is discuss it with your physician. So we are discussing with you this evening. This is not new information. This is the same information that was produced 2 years ago. The USPS task force is simply suggesting that we review data that we reviewed 2 years ago. Again, keep in mind, this is not a finalized statement from United States Preventive Services Task Force. This is a suggestion. So the fact that the media, Washington Post, CNN, the New York Times, blasted this onto your internet screens this afternoon may have been a disservice to your health. So we're hopefully going to clear up some of that for you. Again, in this era of instantaneous media announcements and pronouncements about your health and medical data related to your health, it's very important that you stop, take a breath, analyze the data, and indeed ask your doctor. But quite frankly, we have discussed this issue every time you've come in for an annual physical, and I do believe you've also discussed it with your cardiologist. So without further ado, our guest speaker for this evening is a cardiologist. They're the specialists in preventing heart disease, strokes, and heart attacks. So let's get the real scoop from a board-certified cardiologist who can tell you. Dr. Yamamoto, would you like to take over?
All right. So again, when we talk about preventing heart disease, we mean we're trying to prevent heart attacks, heart damage, and strokes, which is brain damage. So the PSTF, Preventive Service Task Force, put out their draft statement today suggesting that we need to consider whether or not we should initiate aspirin therapy. And I want to emphasize a couple of points. One, this is a draft statement. Two, we're going to find out that this isn't anything new. This is recapitulating something that we stumbled over 2 years ago. And most importantly, they're talking about initiating aspirin for someone who's not on it already. So I'm going to flash this subliminal message up a few times. If you're already on aspirin, you're on aspirin for a reason. Typically, you're on it to prevent brain damage, to prevent a stroke, or to prevent heart damage and prevent a heart attack. Being on aspirin is not the same thing as initiating therapy in somebody who doesn't need it. That's a difference. So who are the PSTF people? Just to be clear, it's a great bunch of volunteers who analyze established data. So they're not doing anything new, they're looking at the old. And they're made up, it's not a government agency, and it's not a professional organization, it's not a clinical organization. They're made up of preventive medicine people, preventive medicine doctors, family medicine, pediatrics, and gynecology and nursing. So they look at the old data to try to understand what type of guidance they can garnish from things that have been done. Now, in contrast, our professional societies and our clinical scientific research societies are always looking for current data, doing the research, and putting out guidelines. So in fact, the American College of Cardiology and the American Heart Association, who in no way are represented by the PSTF folks, have already made a statement on this 2 years ago. And so the PSTF people took basically this data and are trying to catch up. That's normal. That's what they do, is look at old data and try to keep everything up to date. So 2 years ago, the ACC, American College of Cardiology, and AHA, American Heart Association, we routinely put out these statements. And so in 2019, we put out a new recommendation that, again, makes us consider when do we want to initiate or start therapy for what we call primary prevention. Now, the reason we had to do this in 2019 was because we've had new data. Years ago, back in the 80s, aspirin was found to be astonishingly protective. The first study came out in the 80s called the Physician's Health Study, looking at predominantly men. And if a guy like me took an aspirin a day, I lowered my chance of a heart attack by about 45% a year. That was such a big benefit that we told everybody, take an aspirin, no questions asked. The problem with that data is in the 1980s, we did not have statin therapy. Statins arrest plaque development. So everybody back in the 80s, my age, had tons of plaque. We also used to smoke back then. And so if you have plaque, aspirin prevented clotting of that plaque, leading to strokes and heart attacks. But we redid this data with a bunch of basically low-risk people, a major Australian study published just before 2019, looking at people, and almost all of them were on statin therapy. That matters a lot. That means they never grew plaque. And the event rate was so low, if you take a low-risk person who does not have arterial disease, particularly if they have prevented it from happening, mostly with statin therapy, that there was, adding an aspirin, all it does was give you bleeding, principally things like ulcer or gut bleeding, at a rate equal to the brain damage you get from strokes. It's another thing to keep in mind is when you're looking at these statistical arguments, we're equating, gosh, did I really want to have a bleeding ulcer, or do I want to have permanent brain injury? So those things are considered equivalent in these statistical arguments. So emphasizing primary prevention, people initiating therapy who don't have disease. That's what primary prevention means. If you do not have atherosclerosis, if you do not have any plaque, and if you're on a statin in particular, your event rate is so low, we probably don't need to do much of anything. So that's what we said 2 years ago. Keep in mind the PSTF people simply are rehashing this data for their regular updates. They began this data analysis more than 2 years ago. It just took them this long to go through all of the numbers. But primary prevention, what if I do have atherosclerosis? What if I already have a stent? What if I have plaque in my arteries? We call that secondary prevention, or the management of atherosclerotic disease. It goes by a lot of names. CAD for coronary artery disease, PAD for peripheral arterial disease, and you'll see that we also call it something ischemic heart disease. Plaque. I love this picture. It's a pipe. This isn't an artery, but your arteries can look like this. Rust in pipes. This matters. It's not just blocking off flow. It's making sure the flow is intact and things don't clot and flake off. Remember, that gunk getting up into your head is brain damage. So remember, we've had a long-standing recommendation from every professional society known about what do you do if you have, in this case, stable ischemic heart disease. That means plaque in your arteries. This is not initiation of therapy without disease. This is people if you have known plaque. And we call it a class 1 recommendation that you need to be on aspirin. We actually, if you have a lot of plaque, you need to be on more than aspirin, but that's another discussion. If not, it's going to clot off. 2 years ago, when the AHA ACC put out the recommendations that said, oh, if you're a really low-risk guy, you don't need to be on aspirin, and the press said, oh, aspirin's bad, stop your aspirin, stop your aspirin. I had at least one patient stop his aspirin, promptly clotted off his stent, had a heart attack. He did survive, but only barely, and it was utterly inexcusable. Stopping aspirin's not the same thing as saying, I'm a low-risk guy, I don't need to start it. Okay, in the old school way of thinking, all we did was ponder risk factors, as if atherosclerosis was something we could avoid. You pondered your risk factors and you played the odds game, and indeed, if you don't have risk factors, odds are nothing's going to happen to you until you're old enough, because age is going to make a change. And our new way of thinking, we all need to know what our plaque burden is, okay? Because you're not going to feel plaque in your heart arteries or plaque in your arteries going to your brain. But you know what? You can know what it is. This is why you work with your doctor, whether it's us or anybody, because you look at those risk factors, which we now think are things that accelerate the natural aging that leads to plaque. And you know what your arterial health is. This is an example of, might even be my arteries. It's a healthy, nice, clean flowing artery, okay? And this is an artery that's a little less healthy. This is plaque sitting here. And I want you to look at this thing right here. What is that? That's a clot, okay? That is a clot on an artery. This is a fellow who walked into my office not that long ago. You know, he didn't have symptoms. He hadn't had a stroke yet. He never had a brain injury, never had a heart attack. But for all sorts of reasons, I knew he had plaque. This is why we take aspirin or something else. He's actually on more than just aspirin. That little floppy thing right there is a clot. And you know where this is? This is a couple inches below his brain. If that little clot breaks off and goes into his brain, boom, permanent brain damage. And you know what? That was preventable. And we did prevent it. This fellow did fine. We kept him on his things to prevent clotting so that he never had a stroke. So don't stop your aspirin if we've asked you to take it. You might think that this is a big deal. So keeping with our fast pitch, quick answers, we all need to know what our arterial health is. You don't know unless you look. We certainly will help you know your arterial health. And if you're not one of our patients, it's something you can ask your doctor. It's an easily knowable thing. You also need to know if you have atrial fibrillation. That's another discussion. But this whole task force thing neglected to factor in the fact that as many as 30% of our 70-year-olds have AFib, which is also going to lead to clotting and a stroke. And again, aspirin may not be enough for that, but you have to ask the question. And if your doctor, we in particular, have asked you to take an aspirin, don't stop it. We asked you to take an aspirin for a reason. We don't just randomly throw pills around because it makes us feel good, and we don't own stock in Bayer. So if we've asked you to take an aspirin, don't stop it. Remember, growing up and having good health isn't something that just happens. You have to build it. And everything we just talked about is available in our book, which you can still get. So remember, know your health, build your health. You can prevent a stroke. Please don't stop your aspirin without a reason, and the reason should come from your doctor.
Thank you, Dr. Yamamoto. And if you still have questions about whether or not you should be initiating aspirin, feel free to discuss it at your annual physical. Remember, today's news report was about starting preventive aspirin therapy over 60. You don't need to investigate whether or not you should be on an aspirin or not if you already are on one. We made that decision. This is about initiating aspirin therapy. So despite the scary headlines from today, it is true many people over 60 benefit from aspirin. Don't get scared by the headlines. I know many of you did. Don't be. Hope that helps. Thank you.